I'm Danielle Claus. I'm Executive Director for the Southeastern Ontario Academic Medical Organization, and I'm pleased to be launching our first in an 8-part webinar series where we're going to be talking about eConsults as they relate to specific specialties. So we welcome Richard Van Wylick, Dr. Richard Van Wylick, one of our pediatricians here to launch our series with us today, which is a great launch given his involvement in education. And the department's general interest in all things virtual care, deeply involved in eConsult and e-referral. So welcome, Dr. Van Wylick, and we'll hand it over to you.
Thank you, Danielle. That was, I expected you were going to talk a little bit longer, so I was just messaging Savula that I need to share my screen. So Savula, when you get a chance to enable that, that would be great.
Perfect.
It's a fairly small group and lots of people that I know. It's nice to see some faces to put to some names that I see often now. We don't get to do that in person as much as we used to. I am now the host, I guess, and I needed to admit somebody though. I hope I did that right. Savula, I don't know if you're still able to admit Terry. He was trying to join. So it's great to see people. We can't do that in person as we used to, and see people in 3 dimensions, as I like to say, but I guess this will be a suitable alternative today. And it's a fairly small group. A few people that I know well enough to be nervous about talking in front of them. So welcome everyone. Hi, Brent. Always makes me nervous when you're around. So we're going to jump right in. If I think I can share now. Let's see here. Danielle, you can see that? That's great. Well, thank you. So let's move ahead here. Okay, now I need to get it to move for me. Of course, we have to declare our financial interests. This is a CMO webinar, and of course, I'm faculty, and CMO supplies money to my corporation as part of that. And you'll see that I'm also an employee of Queen's University and in a few grants from a few places. Most of them are not-for-profit or government organizations that my office receives grants for. There were some objectives. I think they were circulated. It's really about trying to understand where eConsult fits into our practice and how to effectively use it. So, this is the traditional approach, obviously, to patient care. This actually is a picture of Dr. Chris Padfield. Probably most of you don't remember or didn't know Chris. Chris was a pediatrician. He was one of the faculty members when I came here as a student and stayed as a resident. He was definitely, the pediatrician's pediatrician. He seemed to know everything. And I certainly remember at the time thinking he was really old. I bet you he's actually younger in this picture than I am now. So I guess he really was very old. But of course, Chris would have been, I think, somewhat, maybe a bit taken aback by this whole eConsult thing and the whole way that things are changing, and that, he certainly was very much the traditional approach to taking the full history, the physical, being there present, talking to parents. And that's the way certainly I learned and continue to think is an important part of practice for sure. We also, the other traditional thing we did a lot is we talked a lot to people on the phone. So, we used to get, and we still do very regularly, either get phone calls or these, in the days when we could see people in person, hallway conversations about, what to do about a certain patient, what to do about a certain problem, how to work up this or that or the other thing. And while this, of course, I think is still effective and still does provide a lot of useful help to patient care, it is fraught with a few problems, one of which is that you don't always have all the information. You really only have what is conveyed to you orally, and you're limited in your ability to gather information beyond what can be given to you orally. And rarely, at least in most people's practices, although I think, and I hope this is changing, we didn't write a lot of it down. We didn't document a whole lot of what happened in these phone calls. Sometimes it was even hard to do that because there wasn't a mechanism. There wasn't a patient that you had seen. You didn't already have a record. You didn't already have a place to put it. And so the easy thing to do was just to give the advice and move on and hope that it was all okay. And for the most part, it probably was. So now we move to eConsults. This is actually from my list today. I took out all the identifying things. So, now I get this list, an email telling me that there are cases in my queue to be looked at, and it shows up much like this. There's more details. I whited out obviously the parts that are identifying anybody, but And I get to answer questions this way. It helps with that documentation issue. Once you answer the question, it's at least documented in this system. There's at least a place where you can go back and see what advice you gave. And it can provide timely access to people for questions that are waiting. So I just want to make sure, I think now that I'm the host, it's telling me 4 people are in the waiting room, and I don't know if I'm the only one who can let them in. I don't want them sitting there forever. Are you able to let them in? Okay, so I can ignore that, thanks. The other thing that's changed in that where we're moving, and I think it's an important part of this discussion as well, is that certainly in the Department of Pediatrics, we're moving to e-referral. So the opportunity to receive those referrals electronically, the ones that physicians maybe think need to be seen in person or aren't sure can be sent in this way. And they can be readily triaged, but a fairly new addition to that is that I can at least now respond to sometimes even the regular referrals that come in and give the option of responding as an eConsult. And just providing either interim advice to the person who's referred them so that we can get going on things while they're waiting. And waits are certainly an issue for care now anywhere. We can either provide that interim advice, or on occasion you can actually avoid entirely an in-person consultation if it can be answered in this way effectively, and also provide that documentation. This in many ways reminds me of what still happens when we receive paper-based referrals, and that it wasn't unusual and isn't unusual to write a little note on the bottom. Why don't you try this? Why don't you do that while they're waiting? And then we'll see them later. Sometimes after you do that, you get a note back saying, well, that all worked out just fine. You don't need to see them anymore. So that can be an effective way to manage patients. So, I've been doing eConsults now for a couple of years. And I think I've come up with a few ideas around where can we be helpful for eConsults in pediatrics. I don't know that I have the full answer here yet, but I'm going to try to tell you a few ideas that I have. One of the things to realize that as a general pediatrician, we have a very broad practice, and peds is one of those specialties. There are not many in number where we're not about a disease process. We're really about an age span and a developmental approach to problems. And so this is from that very same list you saw yesterday, and you see there's a 6-month-old on here, there's a 4-year-old, there's a 9-year-old who have been sent in. But we also get newborn questions, adolescent questions, and they really can come about anything and everything. And so it's very broad. And so sometimes what we've received is very suitable, very easy to answer, very straightforward to give some advice on, and other times it's not so easy. The other thing I might say about eConsults generally is, and I don't know what other people's experiences with them is, but certainly for peds, because again, we're this sort of broad age group and we don't limit it to, questions about hepatitis, where, you're only going to get questions about hepatitis. I never know what lies behind this click once I click on this case and I open it up. It could be absolutely anything. And because I think, the clinicians who are sending them in are also, skilled, knowledgeable, capable physicians, they sometimes send some very weird things. And so it's, I'm also haven't been afraid lately to say I have absolutely no clue what you're asking me to answer. And so because it's just a very weird problem. So and sometimes that in itself can be reassuring. So what are kind of good things that work for peds? Well, because we're an age based, a developmental based specialty, particularly in general pediatrics, I think a lot of times what we provide help for is where people have difficulty interpreting either findings or other things on their history or physical that are not typical or something that they've encountered before. And for pediatrics, that's often things like congenital or minor congenital abnormalities. So this child has this funny looking this, or this unusual looking that, or this dimple here, or this dimple there, or this extra part here, or this extra part there, and they're not sure how to interpret that. And so as pediatricians, we can fairly easily help with that because we've, where our experience is we've seen this broad range of children and we've been educated and trained in sort of recognizing these problems. So, being an old guy, still doing eConsults and maybe not being so old after all, I do still pull out my books in those cases and look at my embryology textbook, or sometimes I'll look at Smith's recognizable patterns. So maybe that's the other thing I have, is I just have the books that I can pull out and advise people from. Or sometimes it's about interpreting a particular pediatric finding or clinical finding. And again, I think that's where our expertise comes in. Or in interpreting investigations or other things that have been done for children where the physician is just unsure how to interpret that in the pediatric context or in the age context of this particular child, and what is the significance of that finding. ECGs are a common one there. The pediatric ECG, of course, requires different interpretation sometimes than the adult one. Another common area where I find that we can be very helpful, and now I'm going to tell you that you probably don't need me to do this for you because there are other tools that are out there, is in interpreting lab results. So again, lab results and laboratory ranges and the interpretation of lab results in children sometimes can be different and varies by age. What is a normal, say, hemoglobin in a newborn baby versus a young adolescent versus an older adolescent, or one of the ones that seems to pop up every once in a while, a low-ish hemoglobin in a 14-year-old adolescent male who is early in puberty due to delayed puberty. They haven't had the testosterone increase that you would see in the average 14-year-old, so their hemoglobins remain a bit low. And we end up helping people interpret those results. Alkaline phosphatase is another one, often elevated mildly in adolescents as they're growing quickly. And so I'm just going to tell you that I turn to this tool to help with that quite often, if it's not sort of in my mind, which is the Caliper tool from the Hospital for Sick Children, which actually helps you on an age, sex, and to help you interpret laboratory results in that context. So turning to that, plus putting it together with clinical knowledge and judgment, can help people interpret lab results that you're just unsure about, or the lab has provided a range that doesn't really match the clinical status of the patient. The other thing that we can be very helpful with is that pediatrics is very much an observational specialty. And this is maybe where I struggled early on with not just eConsults, but with telemedicine in general. There is something about how we examine patients in pediatrics is very much about observation. What does it look like? How is the child interacting? What kind of things are they doing? What kind of things do we notice? Is much more common and big part of the physical exam than the more traditional sort of standardized maneuvers. This is one of the things that I like to tell students. You may not be able to get a 4-year-old to do very easily to do strength testing for you, for example, but if they can run across the room and jump up on the exam table without any help and get up there, they probably don't have any real significant strength problems in at least their lower extremities. And they probably certainly don't have any significant balance difficulties if they can do that as well on an age appropriate basis. And so you develop this kind of sense of what's normal, and that you get this sort of sense of what a child should and can do, and when you just sort of pick up little things. Another example might be just the other day when I was in clinic and I looked at the child for a while, and I looked at the mom and I said, do they have tics? And you just suddenly notice these things that other people just kind of don't even seem to notice after a while because they've just been there so long, or because the child hides it very well. So where does eConsults fit in this? Well, certainly I think we can be very, very helpful in helping people interpret these lumps, bumps, and physical findings. And every single parent these days, parents are relatively young, let's remember, has readily available, on demand, within seconds, always within reach, the ability to capture just about anything that their child is doing. And they often capture these things even if they're not thinking at the time that it's for you to look at or for your purposes of examination. It's very common now, even in the inpatient clinic or the in-person clinic setting, for me to ask parents, do you have photos of this? Do you have a video of that? Do you have some sort of recording of something that's happened in the past that we can't see in the moment? And those kinds of things are readily and easily transmitted by eConsult. So it's very, very helpful. And one of the more common things that I do when I send eConsults back and ask for more information is to ask people to attach photographs or to attach videos or to attach some sort of recording of what it is they're concerned about. One of the more common concerns that can be addressed this way are when kids are having unusual spells or unusual movements that someone is not sure about. It can often be, you know, we're unsure if this is a seizure, we're unsure if this is a habit, we're unsure if this is a normal. A quick video taken by a parent sent to their physician who then sends it to me can very quickly and readily, in many cases, help us at least triage those into the right category of just ignore it or send it for more investigations. So, you know, what also just doesn't work well for eConsults, because, you know, not everything is suitable, and there have been not a lot, but there certainly are times where I receive eConsults and I just think this is not something I can readily or effectively deal with in eConsults. And like, you know, a popsicle that melts in the sun, a time-sensitive problem is not something that's well dealt with in an eConsult. And there are many time-sensitive or many things that may be fleeting or difficult to deal with. And perhaps I know that I'm a bit slow on eConsults. Perhaps that's just me and I'm not fast enough at answering them within seconds of arriving in my box. But a problem that is going to be, that needs to advice now, in the moment, in the next 2 hours, in the next 3 hours, is just not effectively dealt with by eConsult. And occasionally we receive those. And I feel quite bad about them, because by the time I open them up and get to them, the problem is either gone or should have been dealt with, or perhaps already I expect has been dealt with. And some of the more common things that applies to are newborn problems. Newborn problems, almost all of them are relatively time sensitive. At least many of the questions of, you know, what do I do about this baby with hyperbilirubinemia? That really should be dealt with now, and is much better dealt with a phone call to someone or an in-person referral than by eConsult. By the time I get back to you, treatment probably should have and could have been initiated. And probably what I'm going to tell you is that they need to go see someone anyway. So not a great way to, not a great eConsult, and we do get them on occasion. This is just to remind me that newborn problems are part of that. I kind of have this rule that I made up around access to care for pediatric patients, and that is that no patient should wait for care longer than their age. So if you are, and that's why newborn problems, almost all of them are things that need to be dealt with within a very short period of time. Even newborn failure to thrive is probably not best dealt with by eConsult and asking me what to do. They really should be seen, examined, and a plan initiated quickly. So what kind of things make for good eConsults? I've kind of tackled this a little bit. I think one of the important tips that I would give people when they're sending in the information in an eConsult is that, and this is something I really reinforce with my learners on a continual basis, growth is a vital sign in children. Growth is something that we use and look at very carefully to help us triage big problems from little problems, if you like. And if there's any piece of information that you can include that you might not think about right off the bat, it's growth. And often, and I expect in almost all practices, people have longitudinal growth measurements available on the children. They have current growth measurements available. And so if those can be attached or sent just almost as a matter of routine, it's something that can really help in the assessment and triaging of a case. And that can be as simple as attaching a growth chart. Obviously, these are a couple of growth charts that cause some concern. And obviously, most of these now are not done on paper with a marker like this, but rather easily attached from most people's EMRs and generated very quickly. So that can be very helpful. those videos and those photographs are really critical. And so, especially if you're talking about a lesion, you're talking about a lump, you're talking about a bump, you're talking about a funny shaped head, you're talking about a dimple, a sacral dimple, you're talking about a congenital abnormality. A description of the abnormality is obviously lovely and great, but nothing replaces the ability to actually see it for yourself, and can often preclude me from recommending that somebody needs to see it in order to understand what it's like in person. So please attach those photos. And it really, honestly, I think all of you have experienced this these days. It's just a matter of asking the parents. They have these photos. They've already taken them. They're already on their phones. It's just a matter of asking them to send them to you so that you can attach them. There are some limitations, clearly, to eConsults for sure, and we talked a little bit about these, but the first thing is, again, to remember that we really do cross the entire age span. So that really makes it sometimes difficult for a general pediatrician anyways, to define a scope of practice that easily. So to define, these are the problems, these are the only problems, this is the only set of things that I see eConsults for. So you should focus on just sending me those things because I know I can answer them. We have to leave it, we end up leaving it fairly broad, but that can mean that you get eConsults where you have to be very careful as a provider to understand within yourself, what are your limitations? What is your scope of practice? When should you decline to try to answer the question? Because there is this internal sense that when you get an eConsult and it's there in your box and somebody has chosen to send it to you, either the person themselves or the system that sends them, there's this temptation to want to answer and help. And so you want to give an answer, you want to tell them. It can be very difficult to say, you know what, that's just not for me. If I could advocate for any one single improvement to the eConsult system, it would be for the ability for me as a provider of eConsults to directly recommend a different provider. So rather than just saying, oh, I think you should send this to X, or I think you should send this to Y specialty, to directly say, I know Dr. So-and-so does eConsults here and is the right person to answer your question, and essentially redirect for the person making the request the eConsult, or to make it easy for them to redirect that consult would be great. Often I may know that they provide it, or I may not know. So, there are questions sometimes where I go, this is a great question for a pediatric orthopedic surgeon. Probably they're much better suited to answer this than me. And I've had this before, funny looking spine x-rays or something like that. And I may not know who are the pediatric orthopedic surgeons on eConsult. And I may not even know if there are any on eConsult in the entire province that people can access. So it would be great. And from a CMO perspective, if we could drive those to CMO physicians and knowing who's who in the system and who else we can recommend, I think that would be very, very helpful. The other limitation is, although I mentioned documentation here is better than documentation on the phone, you are still somewhat limited in that the documentation is done within the eConsult system. And so, and often because I've left my practice open to consults from across the province, those requests can come from pretty much anywhere. And so it may, sometimes I'm not sure, does it just sit there? How am I going to get this back? Who's going to be able to look at it again? So understanding the documentation is very important. The other, certainly the limitations around physical examination, particularly if the person who's asked for the eConsult hasn't actually examined the patient, which happens fairly regularly these days, can be a real significant limitation. They've done a telemedicine consultation themselves. They haven't examined the patient in person. And then they send you an eConsult. These are very difficult to answer unless that's happened at least by someone and provides that reassurance. I guess I talked more than I thought. It's 8:55 or so, Danielle. I'll turn it back over to you.
Thanks very much for that presentation. We did get one question during your presentation, which was, can you actually post a video to an eConsult? And the answer is yes, you can. And there's a little description in the chat field for those following along as to how you do that. So you need to look for the paperclip icon to actually attach your video when sending an eConsult, but it is totally possible to do that. So maybe with their time remaining, we can just open it up to questions. So if people want to either put up their hands or put a question in the chat, that would be a great opportunity. So Dr.
Oh no,
Wood.
the pediatric orthopedic surgeon.
That's right. Welcome to the call.
Thank you. Thanks for the talk, Dr. Van Wylick. I just had a couple questions for you from the provider side, because I don't yet do eConsults, but Dr. Borshnick does. But I haven't picked his brain about any of these. So I was just wondering if you could comment on the timeline of response. So how frequently you check the eConsults and respond to them. And if you have a timeline that you have to respond by, certainly with newborn issues, as you mentioned, or more urgent things, you want to get to them sooner. And then my second question was just about the degree or length of response that you provide. If you can just comment.
Yeah, so Christy, I guess the answer is it varies a fair bit. I try to check pretty much as soon as I get them, just to make sure there is nothing urgent, because I've had that instance where, you know, it's something urgent. Doesn't mean I necessarily reply. I think Danielle can probably answer better about what the expected timeline is. I think they like you to, they definitely bug you if you don't answer within 7 days. I can tell you that. By 5 days, they start like almost warning you. And, but I think ideally they'd like them answered within 24, 48 hours if possible. And I think many people can achieve that, but it can be demanding from a provider point of view. You have the ability to limit geographically where you get referrals from. You can limit the number you get in any certain period of time, and you can certainly turn it off for periods of time. I've used all of those at different points in time, because sometimes you just need a bit of a rest from it. They do sometimes come in clumps. So it's not, you know, it feels like, especially if you empty your box, you know, within an hour, it's going to start filling up very, very quickly. It kind of slows down if you leave some in there. And as soon as you empty it, boy, they start coming again. And
so
they can come from go ahead, Danielle.
I was just going to say, so the typical expectation around receiving a response is 5 to 7 business days. And you'll get an email letting you know that there's an eConsult there for you to answer. So it's not like you have to keep checking yourself. You'll get an email notification saying there's an eConsult for you. And then to Dr. Van Wylick's point, you can turn on and off your availability, and you can also limit the scope of the region. So is it just the Southeast? Is it the whole province? We've actually tailored our selection process within the region so that you can be as specific as you can. So for you, it would be, you know, orthopedic pediatrics, for example. So we can really narrow the focus for you as well.
Dr. Wolfram commented about, you know, the reassurance, and that's a great point. I would say 95% of the time, my eConsults start with, I think you're on the right track. I agree with where you're going with this. So if that reassurance is helpful, then that actually is reassuring to me, because sometimes I feel silly saying that. And, you know, how helpful have I been if I just said you're doing the right thing? So thanks, Brent.
And I know we've been running some technical information for you in the chat. So for those that are new to eConsult in terms of how it works and how you access the material, primary care providers are paid for sending eConsults, and you can see that information listed in the post about the K738 code that would be used when you're sending an eConsult. Specialists are paid differently in terms of responding to eConsults. That's actually managed through CMO. Do others have questions that they'd like to be asking? I know we've got a minute or two left.
The other thing I can say, Danielle, sometimes is I get asked, and I think it actually is useful, I get asked about resources, you know, so what resources are available for this or that or the other thing. And I think that's an important role for pediatricians. Obviously, that's more difficult when you're receiving them from across the province, and I don't know what's available in Chatham for a patient. I don't know what the specific resources are. So that is both a strength and a limitation, and perhaps would drive people to, if they have the option to send it to somebody that they know is local rather than just sending it to the bigger pool, particularly for those kinds of questions, I think that would be a little tip as well.
Right. And what I would say is that we do have a CMO digital health team. So if you have questions about eConsult and the appropriateness of something, or how the technology works, you're certainly welcome to send an email to our CMO eConsult team. So I think it's CMO Digital Health is the email address, which we'll put in the chat for you. And just send us a note and we'll help you out where we can in terms of the technology, its functionality, how we can register you to use the system. If you have any issues or concerns with the technology, we can connect you with OTN, which is the back end of the product that's used to support the eConsult system. Thanks for joining our first session. We welcome your comments in the chat in terms of, does this work for you as a learning opportunity? Are there questions or things that we can be doing with respect to the format moving forward?
Have a great day, everyone.
And thanks to Dr. Van Wylick for being our first speaker in the series.
See you next time.